What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keone Tita. Keone, how are you today?
I'm doing wonderful. How's everybody out there today? Brian and I just want to talk about something that is kind of insidious in our society, and that's hypertension, or what we know as high blood pressure.
Mm-hmm.
And so, exactly what is high blood pressure? It's technically a measurement of the force of blood against your arterial walls from the contraction of the heart. Contraction would be the systolic, the top number that you see on a blood pressure reading, and then also the relaxation of the heart, which would be diastolic, the bottom number of the reading when you're taking a blood pressure. So when the heart contracts, that pressure of blood going into the arteries is what's measured as the top number. So you could expect the heart contracting, creating a higher number than heart relaxing and what the pressure is against the arterial walls.
Yeah, that makes sense.
Yeah. So systolic over diastolic. It's one of the things that is the main indicator of morbidity and mortality. So it's a very simple objective measure that you can do at home, do in the doctor's office. And it's something that everybody really should do, to make sure that their blood pressure is good.
Yeah.
And typically I will go over the stages of blood pressure and what is really a good blood pressure. But think about this. This is really interesting because your heart over the course of a single day beats 100,000 times about. All right, so think about that. Each contraction of the heart and the shear forces against the arterial walls from each pump of your heart, over time that can create problems for the heart. And think about what water does to for example, the Grand Canyon. Over time, what it does is you can create a lot of inflammation there if you don't have good blood pressure.
Yeah,
and then over a lifetime, it's like 2.5 billion times of heartbeat. So
yeah, that Grand Canyon metaphor analogy is pretty spot on. I like that because if your blood pressure is even normal, 120/80, or what we deem pretty normal, you multiply that by the 100,000 times a day, the amount of force that you're pushing against your arterial walls throughout the day. It's crazy.
Right. And so that's part of the reason why it's really important to make sure that your blood pressure is under control.
Mm-hmm.
So chronically high blood pressure is the number one cause of cardiovascular disease. So we're talking about atherosclerosis, heart attack, heart failure. And if you live long enough, and your blood pressure is not in check, most people's aren't, you can expect to have heart issues the older you get. And indeed, that's what we find.
Mm-hmm.
The older we get, eventually the heart is going to fail. I mean, think about it as a mechanical pump that eventually gives out and has to be replaced. So if you live long enough, that certainly can happen. And the other thing about hypertension or high blood pressure, it's the major cause of blindness. So think about it. Every time the heart contracts, the little capillary beds in your eyes have to deal with that force. And if you constantly have high blood pressure, it's going to break those capillary beds to where they no longer can oxygenate tissues in the eyes, and therefore you can go blind.
Wow. I didn't know that. That's fascinating.
Right. So think about and it's a major cause of kidney failure also. Same concept, right? I mean, all these capillary beds have to feed our organs. So if you have high blood pressure, all the organs are going to be stressed from this. And of course, it's the major cause of congestive heart failure. Now, here's a real kicker for this, is because most people don't know. It's insidious. Like, you don't have outright signs and symptoms a lot of times of high blood pressure. So, you can be going on, each day in your life and thinking that everything is fine. You don't feel high blood pressure for most of us. If you're lucky, you may get some signs and symptoms like headaches and things like that. But for most of us, it's kind of insidious.
Mm-hmm.
And And there's a difference, like there's a medical term, primary hypertensive and then secondary hypertensive. Primary hypertensive just means that there's no obvious cause of the high blood pressure, right? So we don't know what's actually doing it. And then secondary hypertension, there is an identifiable cause. So we're talking about maybe endocrine disorders, maybe kidney disease. It's kind of pushing back on the heart where you get this blood pressure. Complications from diabetes, that would be a cause of high blood too. And here's the thing that's, I guess most people do kind of know, or but the best treatment for high blood pressure is just lifestyle change. It's just manipulating your lifestyle. So let me give you an example on that. It's we talk a lot on this podcast about exercise. And think about what exercise does. Like, let's say you're not moving the big muscles of your body primarily, like your legs, your buttocks, your glutes, or your pecs, your chest, your back, like big muscle areas. When you don't use those muscles, all those capillary beds in those muscles, they basically clamp down. Your body has this sensor that says, oh, well, you're not using these muscles, so let's just shunt all the blood to your core, to the major organs. As soon as you start moving those muscles, those capillary beds will open up. You have to increase blood flow to your muscles. So it acts like a pressure valve in a sense. Like when you exercise over time, you're releasing pressure in the body, so the blood pressure goes down. So over time, that's why exercise is so good for helping control high blood pressure.
So it's going to bring it up, obviously, during the exercise, and then after it's going to.
Well, during the exercise, it should, as the capillary beds open up, so it's especially immediately going to lower the blood pressure.
Mm-hmm.
It's going to lower blood pressure because those capillary beds open up. It's it's releasing like a pressure valve.
Right.
So when you use those muscles, you increase blood flow to those muscles, and therefore blood pressure will come down. Over time, blood pressure will be better controlled.
Oh, okay, because
it's just movement. It's what we need to do.
Right. It'd be similar, and correct me if I go wrong here, but like if you got a garden hose and it's, you're pushing through it too much, and you can increase the width of the garden hose, or you clear it out by pushing more water through it and some gunk comes out. That's essentially what you're doing with exercise and your capillaries, more or less.
Yeah, more or less. Yeah, that's right. You're just helping increase blood flow throughout the body, which keeps to the major muscle groups, and therefore there's not a kind of like a backlog of
mm-hmm.
blood.
Mm-hmm. It's a tunnel that's being used versus an old closed tunnel with traffic.
Right. So it's probably, I tell people, most people probably know this, but it's one of the most diagnosed medical conditions is hypertension, and 1 in 3 U.S. adults are estimated to have high blood pressure.
Yeah, very common.
Right. It's extremely common. But let's talk about kind of the stages of high blood pressure. Let me see here. For one thing, what we know is a blood pressure of 120/80, which is considered good blood pressure. Even with that blood pressure, there's still some evidence that there can be damage to the arterial walls. The blood pressure where we don't see any evidence over time, where we don't see any detrimental effects, is a blood pressure of 115 systolic and over a blood pressure of 75 diastolic. It's always, the units are millimeters of mercury when you're checking blood pressure. So most people run higher than that.
Yeah, absolutely.
Much higher than that. So so right now, a blood pressure of 130/90 is considered high. For me in my clinic, if there's a blood pressure of 150/90 or maybe 160/90, I mean, that's where we're getting into the territory where people should probably be on something to bring it down, medicate them, and then in the hopes of, with some lifestyle change, that you can come off the medications or reduce the dose.
Can you repeat that blood pressure? And this is the blood pressure for you where you would consider someone start investigating medication, is essentially what you're saying. Is that correct?
Right. So let me just go through it as far as like the specific stages of blood pressure, because I think that will kind of bring it home for people. So
Right.
optimal blood pressure is systolic, less than 115 millimeters of mercury, and diastolic, 75 millimeters of mercury. So less than or equal to 75, and diastolic less than or equal to 115. So 115 over 75 blood pressure. That's going to be optimal for most people. And I say most because the older we get, that may be too low for some people. So just as an example, as we get older, it's somewhat normal for older people to need a little bit higher blood pressure. Okay, and this can be a problem for older people. If you start giving them blood pressure medication and try to get them down as low as possible or optimal, you may go too low with them.
Mm-hmm.
But for most people, it's going to be less than 115, less than or equal to 115, less than or equal to 75.
Yeah.
What's considered normal blood pressure is less than 120 over 80. But now let's go through the stages. So pre-hypertension stages, and pre-hypertension can be controlled with lifestyle alone primarily. All right, and that's systolic between 120 and 139, and diastolic between 80 and 89. All right, so that's a category. It's called pre-hypertension. Is where lifestyle change is probably all you need to do. Okay. Right. Stage 1 hypertension is between 140 over 159 systolic, and then 90 over 99 diastolic. So that's considered stage 1 hypertension. This is where most docs are going to start recommending prescription meds to help control it. Again, this can be controlled usually with lifestyle stuff alone. We're talking about primary hypertension here, where we don't know of a cause. It's usually lifestyle is the cause. So if lifestyle is the cause, you can control it with lifestyle. And then stage 2 hypertension is going to be greater than 160 systolic, and then greater than or equal 100 diastolic. And then an emergency situation, I've run into this in my clinic, is greater than or equal to 180 systolic and greater than or equal to 110. That's where I would probably refer to the ER to help bring it down. And typically a diagnosis of hypertension really should not be given unless you've had 3 separate readings on 3 separate occasions of high blood pressure, kind of in a row. And it's really best to take your blood pressure at home. So a lot of people, where I see a high reading, I'll just say, oh, do you have a blood pressure cuff at home? Just take it at home and let's see and track it. Next time you come in, let's bring it in, especially if you're in like the pre-hypertension or stage hypertension. It's not like we immediately jump to treatment, although you can jump to treatment with the lifestyle.
Yeah, absolutely. Do you have them tested at a specific time of day or multiple times throughout the day to get a more accurate reading, or how do you do that?
I usually just tell people to take it when you remember, right?
Okay. That works.
So for me, it doesn't really matter. I mean, if you want to be really scientific about it, you can take it at the same time every day. But there are some normal fluctuations in your day with blood pressure.
Right. Yeah, me.
And also there's certain things that may bring it up or bring it down.
Mm-hmm. So,
and like I said before, I mean, most people do not know that they have high blood pressure, so this is one of the most important things of why you should at least see your doctor or get a blood pressure cuff and check. Yeah. I mean, it's a great objective measure for knowing where you're headed, and the higher blood pressure is and the longer it's high, the more problems that you're going to have later on in life, like we talked about, the blindness, kidney problems, any organ damage, So what are some of those lifestyle things that we can do that can really help control it? Well, one thing is if you smoke, smoking is highly correlated with high blood pressure. If you smoke, you should probably stop or at least reduce it. Of course, we implied that exercise helps bring it down, so being sedentary will bring it up too. For some, high salt intake can be a big issue. Not everybody, but for some, it can be a big issue. And think about what salt does. Salt is a mineral that water kind of follows around in a sense. If you have a high salt environment, your body wants to equalize that by diluting it, right? So it will kind of follow water, and a lot of medications work by helping get rid of sodium, so you pee a lot. So a lot of the diuretic medications will do that.
So the more salt in your diet, is your blood more viscous, or is that jumping 1, 2, 3 more steps past what I need to do?
I mean, I wouldn't say it's more. I wouldn't say it's more viscous. I would just say that within the arteries, you have more.
More content of water and things.
Yeah, you can think about it that way. Yeah, you're dealing with more fluid that's exerting more pressure on the arterial walls.
Okay.
Right? So that's the way I would think about it.
Okay.
Low vegetable and fruit intake. That's a big one. High fructose corn syrup or high fructose consumption. Some people who just eat fruit all day in and day out, that may affect their blood pressure, bring it up. Whereas vegetables, if you eat a very high vegetable-based diet, you'll tend to have low blood pressure. This has a lot to do with the minerals found in those plants, and also some of the phytochemicals in there. High caffeine intake may raise it, at least transiently. Excessive alcohol intake also. And then here's something that you kind of just mentioned was, what about the blood being slightly more viscous? So, it's harder to push the blood through the arterial walls. Well, subclinical dehydration would do that, right?
Right.
So that's going to add a little bit. So not staying hydrated can really be a problem. And then, of course, stress, a high stress environment. Like if you're under chronic stress, then that's also going to raise it. And knowing that's just telling us, a lot of ways that we can treat high blood pressure with just, lifestyle stuff.
Right.
So eat plenty of vegetables. Maybe thinking about, getting your low glycemic fruits in for the most part, or just getting plant-based foods in can help lower it. And then for stress, I mean, we did a podcast on meditation. I mean, meditation can almost bring down blood pressure immediately. And over time, it's like exercise. Over time, the more you practice meditation, just like the more you do exercise, blood pressure will tend to help normalize or optimize the more you practice that.
Yeah, I think it's Aubrey Marcus's book, Own the Day. He cites a specific study, and it was like something like 6 deep breaths, and that's enough to lower your blood pressure a certain amount. So just like speaking to the meditation there, just taking a moment to inhale, exhale is going to help.
Yeah, absolutely. It will. And it's funny, just, breathing correctly, getting that diaphragm to contract and relax and breathing correctly, that actually acts like a pump and massages your organs and increases blood flow to your organs, and in an indirect way can help lower blood pressure, just breathing correctly.
Yeah.
Other things that can raise blood pressure that a lot of people suffer from are sleep issues. So if you're not sleeping, blood pressure will go up. And then also, especially if you have something called sleep apnea, where you're not breathing while in your sleep, you're not oxygenating your tissues, that also can increase blood pressure there.
Yeah, just in response to trying to get the oxygen to the tissues, correct? Yeah.
Right. Yeah. So, how does conventional medicine go about treating high blood pressure? And just for the most part, most blood pressure medications lower blood pressure directly or indirectly via 2 ways, and one is by reducing the force of the heart contraction, right? So if you reduce the force of that pump, the heart, then you're going to not have so much pressure against the arterial walls, right, when it contracts. And then also another way would be relaxing the smooth muscles in the arteries, right? So if you relax the muscles, the arteries have like this, it's like a hose but has muscles surrounding it. If you relax those, then guess what? You're going to help lower blood pressure too. If those muscles are in constant, those smooth muscles are in constant tension, then blood pressure is going to increase.
Mm-hmm.
So reducing heart contractions and reducing the pressure exerted on the arterial wall. So a lot of blood pressure medications work by doing that. And then you have another class of medications called diuretics, also known as water pills. And these medications work by telling the kidneys to get rid of excess water and sodium in the blood, as we were just talking about.
Yeah.
So the medications that work by reducing the force of heart contractions or reducing the smooth muscle in your arteries, these medications are going to be ACE inhibitors or angiotensin converting enzymes, drugs, and then calcium blockers, angiotensin 2 receptor drugs, beta blockers. All those drugs work by either reducing the force of the heart contraction or helping relax the smooth muscles of the arterial walls.
Yeah, I know with beta blockers, you're not going to reach a certain level of like a high blood pressure. So like just as a personal trainer, they taught us with beta blockers, when you see a client who has beta blockers and you're doing some sort of test to monitor their heart rate status or something like that, they're going to have a diminished response just because it basically doesn't allow the heart to pump as hard or relax itself.
or to contract as much, right? So
Right.
somebody that may be on beta blockers, they may be doing an intense workout and you won't see a big rise in their heart rate.
Right.
You know?
Right.
And these, as we kind of discussed through numerous podcasts, is these medications are not benign. I mean, they can have negative side effects,
Well, it
but
even just sounds weird. I mean, just we're gonna reduce the force of your heart contraction, and we're gonna make your blood vessels relax. It's like, oh, geez, I don't know if I want you doing that to me.
Right. So you have to, as a healthcare provider, you have to weigh the advantages and disadvantages of a med, if you're going to use it. And if your blood pressure is like stage 1, stage 2, or even in a hypertensive crisis, I mean, by all means, you need a prescription intervention, right?
Mm-hmm. Yep.
But many times, even with that intervention, you can also do some of the natural things that we're going to talk about in just a minute that can help you reduce the medication, and at the very least reduce it, and maybe come off the medication altogether with some of the stuff we've already talked about, lifestyle, and then some of the natural therapeutics.
Exactly. Yeah.
What's a common name for a diuretic is HCTZ, hydrochlorothiazide. That's a diuretic drug. That's a very common one that a lot of people are on. So that helps. That's a water pill that helps urinate. So if you're getting rid of a lot of water, via the effect on the kidneys, via the kidneys, the blood pressure is going to go down. By the way, the other thing that can significantly lower blood pressure and almost do it in a sense, almost acutely, is anytime you can decrease or become more insulin sensitive or lower insulin levels in the body, you're also going to help lower blood pressure. So high levels of insulin are caused from over consuming just calories, and especially over consuming refined carbs, right? So the more you consume refined carbs, your pancreas secretes more and more insulin. And the more you do that, which most Americans do, eventually the body cannot hear that signal of insulin. So you have these very high levels of insulin that can have an indirect effect on increasing blood pressure. And the way it does it is high levels of insulin cause the kidneys to retain sodium. And then guess what follows sodium is water. So hence the high blood pressure. So if you can lower insulin levels, a lot of people go do intermittent fasting. We go, every time I intermittent fast, after the first day or so, I tend to urinate quite a bit, and that has a lot to do with insulin levels lowering.
Wow.
So that is a, intermittent fasting is a natural way, or kind of like a natural diuretic,
Yeah.
and keeping your insulin low. And eating whole foods will help keep your insulin levels low, as opposed to processed foods, which helps keep your blood pressure under control. So what about the some nutraceuticals or some natural things to help lower blood pressure?
I can guess one.
Yeah, what is it?
Magnesium.
Magnesium.
Is it on the periodic table?
It's on the periodic table, and probably the other mineral that really helps a lot is potassium. So magnesium and potassium, and guess what? Magnesium and potassium are very high in what foods? Yes, of course, your vegetables and fruit, stuff like that. Your whole foods, those are very high in that. And people who tend not to eat whole foods tend not to have subclinical levels of magnesium and potassium, and hence it can affect their blood pressure. CoQ10, ubiquinone is the biochemical name, or ubiquinol, another form of CoQ10, also seems to have blood pressure lowering effects according to studies. And then you probably heard of the amino acid L-arginine, right?
Mm-hmm.
L-arginine, high dose of L-arginine can cause the body to create more nitric oxide within the blood vessels. Nitric oxide is like a smooth muscle relaxant, so it can help relax the smooth muscles of the arteries. And there are just a number of herbs out there that can also help as far as natural muscle relaxers, right? It would be, one is cocoa. Very interesting study. What was it? It was a teaspoon, I think it was, or about a teaspoon, which is about 5 milligrams of cocoa mixed in water a day. Or maybe, maybe it's 5 grams mixed in water. So just making yourself a cocoa drink. I think it was an unsweetened cocoa drink, and they sipped it. They did this for like 3 or 4 or 5 days in a row. Lowered blood pressure quite a bit. Let me see if I can find the actual study here, because it's pretty amazing how that worked, and what it did. Okay, so here's a study. It was a small study, an N of 36. All right, but blood pressure was recorded on 3 separate days. On day 1, no cocoa was taken in. Days 2 and 3 received 5 grams of cocoa and water, or placebo. But so the group that was getting the cocoa, what they found was diastolic and systolic had significant decreases, and that was between 8 millimeters of mercury and 18 millimeters of mercury. That's pretty significant. That's taking quite a bit of pressure off the, and that's working just as well, if not better, than most drugs.
Yeah, definitely significant, just in what you said about the 115 showing no signs of 5 degrees difference, or 5 millimeters of mercury difference in
right.
And that was 8, so that's huge. What's the name of one of the authors and the year of that study, so we can look it up?
That was actually, I don't know the author's name, but that was in the West Indian Medical Journal, the 2014 December, 2:63, 3 pages, 316 through 321.
Cool.
But I think if you just look into like Medscape or PubMed and just typed in cocoa and blood pressure, you're probably going to see that study, and you'll see a number of studies of cocoa on blood pressure, because it seems like cocoa has multiple ways that it works to lower blood pressure. One of the ways is increase in nitric oxide in the endothelium within the arteries. Another way is cocoa is very high in magnesium, and there's a ton of phytonutrients in cocoa that seem to have an effect that may have an indirect effect on blood pressure.
But all right, hold on, I gotta ask you, because you confused me there for a second. With nitric oxide, doesn't that pumps blood to the muscle, correct? That's like why we put it in pre-workouts and things like that. It brings more blood to the muscle.
Nitric oxide is actually what I would think about.
It dilates the blood vessel.
Yes, it dilates the blood vessel. You're right.
Right.
That's
Okay,
exactly.
so then I see how that would decrease the blood pressure.
Yeah,
Perfect.
it
Thank you.
relaxes the smooth muscle, dilates the blood vessels, therefore blood pressure will come down.
Okay, yeah, thank you.
Yeah, yeah. So that's primarily how that works. Another herb out there that works pretty good, and again, I'm going with herbs that there's many herbals out there that can lower pressure, and some are more high force interventions. Okay, and what I mean by that is yeah, you can take them and they can bring them down, but they may come with some negative side effects. So I'm just over some of the herbals that really don't have any negative consequences to
Okay.
taking them. And one herb that is really known as a heart tonic, really good for the heart is hawthorn or crataegus. All right, so hawthorn berry. Um, that's pretty incredible what it can do to the heart. It helps relax heart contraction. It helps relax endothelial cells, so blood pressure comes down. It just seems to have an overall good effect on the cardiovascular system in general.
It can heal a broken heart too.
It can heal a broken heart. That's right. So can cocoa. That's why we give it on
That's true.
Valentine's Day. Yeah. And both of these herbs have tons of phytonutrients in them that have an overall good cardiovascular effect, positive cardiovascular effect. Another herb that a lot of people haven't heard about is olive leaf. Has some research on doing that also. So these are more of the things that I consider more natural muscle relaxers. Okay, so they're kind of, I don't know. I guess you can. They're analogous to some of your prescription meds that actually help relax heart contraction, and then also your arterial wall, your smooth
Yeah,
muscle,
same
help
target
relax.
effect. Yeah.
So natural muscle relaxers again would be the ones that we just talked about. I would think about magnesium, potassium, CoQ10, cocoa, L-arginine, hawthorn, and olive leaf. And then so the other class, the natural diuretics, that diuretics are analogous to like the HCTZ drug. This is dandelion tea, green and black tea. So people who drink a lot of tea throughout the day, especially green tea, their blood pressure tends to be lower. Parsley also. Horsetail or equisetum is another herb, natural diuretic. Corn silk tea, hibiscus tea, and then coriander, a spice, another herb also, and then celery seed. All of these have been shown to be natural diuretics. And
Yeah.
celery seed specifically is an interesting one because they've done a number of studies on a compound in celery seed, and I'm trying to think what that compound is actually a natural calcium channel blocker, and the key compound is called L3N-butyl phosphatide, I think, or 3NB is the acronym for that. But there's never been a toxic dose of celery seed extract known. Again, with a lot of these herbs, there's never been a toxic dose known for almost all the herbs that we just mentioned. But this one you'll find kind of standardized to this 3NB, and you'll find it in supplements and stuff. And there's some decent studies on it for lowering blood pressure. And I use it in my clinic somewhat. I'll use this celery seed extract in a capsule form. And I also tell people to use celery seed as a spice to help a little bit. Olive leaf extract is actually a natural ACE inhibitor, and it works through a number of ways. It actually improves insulin sensitivity and reduces blood lipids as well. Cocoa also does that too, so it has an effect on blood lipids. And then one side benefit of olive leaf is it tends to be antiviral.
Okay.
Other herbal diuretics are persimmon leaf tea. They actually use that in Chinese medicine, and believe it or not, one of my favorite high-powered force interventions for getting blood pressure down is a Chinese herbal formula that's been used for thousands of years to lower blood pressure, and the name of this is Tian Ma Gu Teng Wan. All right, and go to any Chinese herbalist, and they'll be able to find that for you. And it's a safe thing to take. It's something that we use in our clinic. So, Tian, Tian, and then Ma, Ma, and then Gu, Gou, and then Tong, Teng, and then Wan. So Tian, Ma, Gu, Ten, Wan. I'll say that fast.
Yeah, that's
10
pretty
times.
good, Keone. Damn.
But that herbal right there is pretty neat. What it can do. All of them are, but that one's specific for high blood for most people with high blood pressure, and
It's a
it's safe to take.
It's a little off topic, but I can speak to the dandelion being a natural diuretic and that you can use it. And I've used it. And like, I've got a beach trip coming up. Let's say in like a week, I've been
Yep,
eating a bunch of salt or whatever I've been doing. And you can start drinking dandelion tea leading up to your beach trip to kind of thin out, kind of lose that excess water on your body. So that's
that's
speaking
right.
to the natural diuretic effect of dandelion. So I've used that one before, not for hypertension, but for more vein things.
Yeah, yeah. And I mean, I've actually had some of our bodybuilders come in, the actual bodybuilders who may use dandelion tea to help rid
Yeah.
excess water.
Yeah.
They
The
look
MMA fighters were using it to cut weight.
Yeah. Another nutraceutical that we didn't mention is taurine. Taurine is an combination of an amino acids, and that can help regulate and help lower blood pressure over time. It's a very safe thing to take. And what else? I think that's pretty much the main ones that I use. I mean, there's other things out there. I mean, there's some studies. There's a study on aromatherapy where they tested people just smelling certain essential oils like
Mm-hmm.
lavender and lang lang, neruli, and what they found is that just the smell or being around some of these essential oils with people that are pre-hypertensive or in the stage 1 hypertension help lower blood pressure a little bit. That's a really simple thing that you can do. Just using some essential oils.
Yeah, I think that speaks to overall just being more relaxed, and that's what
Yep.
the oils are
Yep.
working to do. So
Right. One thing that we know, there are certain drugs out there that can over time raise blood pressure, and the primary one is just steroids.
mm.
A steroid drug, cortisone, that type of thing. What it does is increase its insulin resistance, which can increase high blood pressure. So you'll find some people who take steroids and they'd be like, man, I'm just gaining a ton of weight on these steroids. And, not only does it make them very hungry where they're over consuming, but those steroids over time cause them to be more and more insulin resistant because it indirectly raises blood sugar. And hence, whenever you do that on the body, you're increasing insulin resistance. You're causing the kidneys to retain more water, and hence blood pressure will go up. So steroids can have a devastating effect on blood pressure. So a lot of times it's just like going through your meds and having somebody go through your meds and seeing if any of those meds are causing your blood pressure to go up. So we see that quite a bit at our clinic. I mean, that's why I love having a pharmacist that we've had her on before, is Mary, go through people's meds and just let them see what actually they can do, what their medications are doing. Either are they causing more harm than good? So it's nice having somebody an expert go through those with them.
Absolutely.
Let's see, what else about blood pressure? I mean, I think that's pretty much it. I mean, my thing is this: there's a number of tests, and we actually did a podcast on this that I think really helps people realize like where they are on their health continuum. And these tests aren't always run by your primary care physician, but one of them is knowing what your insulin level is, like getting that done once a year, like, and getting your insulin levels optimal. If you run a fasting insulin on yourself, the optimal level is less than 3. once you start getting above 5 in the insulin level, you're starting to significantly increase your risk of heart attack. And as insulin levels go up, your blood pressure is going to go up. So that's a pretty good one.
Is that something I can
Kind of
buy over the counter? Like, can I go to CVS today and
No,
get some? Okay.
no, you typically can't. But you can go online. We use something in our clinic. Like if you go to my clinic website, you can go to the lab testing there, and you can just buy that test online.
Okay.
We a company through the labs. You can just click on the link, and then you can pick the test you want to, and they'll wherever you are, you just put in your address, and they'll tell you where to go, closest lab to get your blood drawn. But that one's a pretty significant one. And then for diabetics, they all know, especially type 2 diabetics, they all know what their hemoglobin A1C is, and this tells you how much glycation has been going on in your body over the past 3 or 4 months. And glycation is just a thing that you can think about it within the arterial walls of basically the rusting. I mean, it's analogous to rusting in your arteries, where the arteries become more and more stiff the more glycation that's happening to them. And hemoglobin A1C, that's what it measures, is glycation. It specifically measures it on the red blood cells, how much sugar coating's on the red blood cells, but it's a measure of telling you how much glycation, indirect measure of how much glycation is going on in the whole body, and it's directly correlated to arterial stiffness. So the more glycation you have, probably the higher your blood pressure is going to be. And most doctors will say, okay, well, you have a hemoglobin A between, most normal people have a hemoglobin A1C between like 5 and 5.6 or 5.7. Once you get above there, you're considered pre-diabetic. But really optimal hemoglobin A1C is 5 or less without low blood sugar symptoms. And I rarely see that in people where they have 5 or less. But that's the optimal. So just like the optimal blood pressure is 115 or less over 75 or less millimeters of mercury, your optimal hemoglobin A1C is 5 or less.
Okay.
So, yeah. Another one lab is high sensitivity C-reactive protein, or HSCRP, and this is an indicator of how much inflammation is going on in your body, and major indicator or predictor of future heart attack risk. So the more inflammation you have in your body, the more the body, you get an immune response, the more you have oxidized cholesterol, the more you'll have plaquing in your arteries, hence your risk of cardiovascular disease goes up. Optimal level for that is less than 1. So those are some other tests, and then those are the main tests that I like to run. But there are others out there, like there's a test called Homocysteine, which is a predictor of future heart attack risk, cardiovascular events, and what else? I think that's it. And then you can get into some some of these big cardiovascular panels out there that just go much further than just doing a normal lipid panel for seeing what your cardiovascular risk is. But besides, so this is where you have to go get your blood drawn, or you have to do a blood stick or whatever. But really, the best indicator for assessing your cardiovascular risk is just getting your blood pressure done. You can do that at home.
Mm-hmm.
Just getting it tested and knowing what it is, and really being vigilant about that.
Right.
So so my people say, well, just to give me a general plan, like what can I do to help with my blood pressure? Well, one thing is I would definitely, with the lifestyle stuff, stop smoking. If you're putting extra salt in your food, for you, that may be an issue. For somebody else, it may not. But you may want to decrease that. A big thing for me is stop drinking soda. Sodas are full of high fructose corn syrup and who knows what else. It's just not good for you, like the regular sweetened sodas out there, and that includes diet soda. Minimize juice consumption. Don't be a fruitarian. Have fruit in your diet, here and there, but it should not be the mainstay of your diet, and you should always eat more vegetables and fruit. Start moving is a big one, so exercising and doing it consistently. Maybe supplementing with magnesium and potassium Potassium's an interesting mineral. Magnesium may be problematic too for anybody who actually has compromised kidneys. And one of the main things that will compromise your kidneys is high blood pressure. And then you can think about maybe even taking some of those other supplements and stuff that we talked about to help control your blood pressure. So those are the main things. I always tell people, because I see it a lot, is that your blood pressure medications probably ought to be some of the last medications to come off of. You really want to make sure that your blood pressure is controlled. So if you have a list of medications, that's probably some of the last ones you want to consider coming off, and you definitely need to make sure your lifestyle stuff is in order before you even consider, reducing the medication load there or coming off of them. And again, with blood pressure medications, you definitely need to get in touch with your doctor and tell them what your plan is, and they can help you come off some of those.
Yeah, absolutely. But the target is 115 over 75. It is not 120 over 80.
Right. That's the optimal target, right? That's where we found where the studies have found no evidence of any end organ damage or damage to the arterial walls at a blood pressure of that or lower. All right. So that's the target for most of us. It may not be the target for older individuals, because older individuals, as we get older, our arteries, there is a natural phenomenon where our arteries may become a little bit more stiff and things like that. And if you significantly lower the blood pressure with a slightly compromised cardiovascular system in an older individual, you may really run into where they can't effectively get blood to their organs, and you can passing out episodes. So it's for older individuals, it can be an issue. And I tell people to really if your blood pressure is getting really low and you're getting spells, but when you test your blood pressure, doctors say, oh, you're 115 over 75. That's great. It may be a problem for you. It may be a problem that it may be too low. That's all. And so, the thought is in medicine is the lower the blood pressure, just like the better it's going to be without, passing out or anything. That may not be true. So with older individuals, you have to be a little bit more vigilant about how low you're going on that blood pressure.
So then just real quick, as I know signs and symptoms of your blood pressure being too low, dizziness, obviously fainting, anything like that. What are some other signs and symptoms that maybe your blood pressure is too low?
Either too low or too high. You may get headaches.
Okay.
Right? What else? You may other things is you may a lot of people may complain of hearing a buzzing in their ears, like a ringing in their ears, or they may hear their heartbeat in their head, like they're have their head laying on a pillow, they hear their heartbeat. What else? High blood pressure is somewhat correlated with arrhythmias too in the heart. So irregular heartbeats may be related to chronically high blood pressure and that type of thing. Yeah. But I for the average person, I would say too low or too high, maybe getting headaches, tinnitus or ringing in the ears. What else? Yeah, that's primarily what it would be. But the best way is to take it, because like we said at the beginning of the podcast, this is insidious. Most people don't know that they have high blood pressure. They just don't know until you actually get an objective measure.
Yeah.
On it.
Yeah, absolutely. Yeah, and it's a great outcome measure for so many aspects of your health and how it relates to later your health and life. So
yeah, I would say it's a primary thing you can do to help to keep you healthy. I mean, it's a primary objective measure, and you can get a blood pressure cuff anywhere. You can get it at any drugstore, and just test. Now we can go into like, are there better ways to test? Yeah, there are better ways to test, but just getting a good blood pressure cuff. And I just tell people, go on Amazon, read the reviews, see which ones work the best, see which ones are most accurate, and then log your blood pressure over like a week or two to really get an idea of what you're doing.
Right.
And the other thing is that I'll always say is make sure go to your doctor. They at every doctor's visit, they should be checking your blood pressure, especially with your annual exam. I mean, you need to get that checked.
Mm-hmm.
Make sure. And the older we get, the more important it is to get that checked, because the number one cause of death, morbidity, and mortality is really cardiovascular events, and high blood pressure is directly related to most cardiovascular events. So heart attacks, myocardial infarctions, strokes, aortic aneurysms, all these things that have to do with the cardiovascular system may be due to high blood pressure. Kidney failure may be due to high blood pressure. Blindness may be due, or your eyesight going bad quickly may be just due to high blood pressure. Your hearing going bad or quickly may be due to high blood pressure. At the very least, keeping it low, it's not going to add insult to injury for any end organ damage stuff that people tend to deal with later on in life. Like we said, you're dealing with a heart that's going to beat over your lifetime up to 2.5 times every time that it contracts. There's no pump out there that can do that without failing at some point. So you really want to make sure that you're taking care of your cardiovascular system. And the best pump ever designed is our heart. Yeah. And if we take care of it, it's going to last us.
It better. We're going to need it.
Yeah, we definitely are going to need it. I mean, until we get to that time and, in the future where you can just take cells off your skin and then grow a new heart, where you can replace the thing. But right now we're not there. I mean, there's certainly, you can get heart transplants and stuff, but you're talking about all kinds of problems with that stuff. And so for some people, the medications are not a big deal to be on long term, but for others it can be. So we just want, me and you were talking about this before. We just, the part of the reason why we do this podcast is to help people not even get to the medications, or if they are on medications, to help them get off, or to help potentiate the effects of the medications so they don't have to be on more medications.
Yeah, absolutely. Make an informed decision with your health. That's what we're here for.
Right. Yep.
Anything else, Gary? I thought that was perfect.
I don't think so. I think we covered it. I think we covered most of the things we want to talk about today. So
awesome. Huge thing. I mean, affects damn near. Obviously affects everyone. Everyone's got a blood pressure, but it's like you said, it's so common. Hypertension, just high blood pressure in America.
It's so common, and it's so easy for most people to treat with just lifestyle intervention.
Yeah.
So
awesome. Thank you. Thank you, everyone, for listening.
Thank you, everybody. All right. Take care.